Due to the prolonged traumatic events experienced in childhood, your developmental learning becomes impaired and shattered. Your ability to gain a sense of self and identity through autonomy, decision-making, engaging socially, positive connection, and self-esteem have been compromised. Those traits were never fostered due to the unhealthy environment you were subjected to. If this sounds like you, keep watching. Hey community, welcome to my channel, or welcome back to my channel. If you're new, don't forget to like and subscribe. It will definitely help my channel grow significantly. My name is Janelle, and I'm a mental health therapist who discusses everything trauma and mental health related. Let's talk about complex post-traumatic stress disorder, or complex PTSD. I'm a firm believer that negative childhood events tend to impact us as adults, especially if we did not receive adequate support to work through the traumatic events. It can have a lasting impact on our mental health and present itself as anxiety, depression, borderline PD, low self-esteem, and substance misuse, just to name a few. Childhood trauma doesn't only consist of physical or sexual abuse. That is a misconception that many of us have come to believe. We wind up saying something along the lines of, "I can't complain about my childhood. It's not like I was abused," or "I know people who have been through so much worse than me. I feel bad for complaining." First and foremost, whatever you've been through, that is your lived experience. When you minimize your experience, you're telling yourself and others that it wasn't a big deal. And I understand that many of us minimize our experience because it's a way of coping with the pain. If we don't make it a big deal, no one else will. Some people think if they don't talk about their trauma, it never existed. And we blame ourselves for why our life has spiraled, why we feel stuck, and why we feel disconnected from ourselves and others. On the other hand, some folks may believe that discussing their trauma will garner pity. They don't want to be seen as weak or someone who has ever been in a position to be abused. What we fail to realize is the person who was abused, tormented, and neglected was a child. You were that child. Essentially, complex PTSD is repeated exposure to traumatic events. The definition I'm going to use is from the World Health Organization's International Classification of Diseases 11, also known as ICD-11. They describe complex PTSD as exposure to an event or series of events of an extreme threatening or horrific nature, most commonly prolonged or repetitive events from which escape is impossible. In addition, complex PTSD is characterized by the following. Number 1, severe and persistent problems in affect and regulation. Number 2, beliefs about oneself as diminished, defeated, or worthless. And number 3, feelings of shame, guilt, emotional flashback, or failure related to the traumatic event. These symptoms cause significant impairment in personal, family, social, educational, occupational, or other areas of functioning. Complex PTSD also has the core elements of PTSD. Number 1, re-experiencing the traumatic events in the present and in the form of vivid intrusive memories, flashbacks, or nightmares. There is a fear, horror, and a strong physical sensation as well. Number 2, avoidance of thoughts and memories of the event or events, or avoidance of activities, situations, or people reminiscent of the event. And number 3, persistent perceived heightened current threat, hypervigilance, or enhanced startle reaction to stimuli such as noise. Just like complex PTSD, these symptoms cause significant impairment in personal, family, social, educational, occupational, or other areas of functioning. PTSD can occur at any time during one's lifespan following exposure to a traumatic event. PTSD occurs 3 months following the exposure, and it can also occur years after the exposure. Complex PTSD can occur during one's lifespan, usually after repeated exposure to traumatic events and/or victimization. Symptoms tend to be more severe and persistent in comparison to PTSD. Exposure to repeated prolonged trauma in early development is associated with greater risk of developing complex PTSD rather than just PTSD. I agree with the author and therapist Pete Walker, who wrote the book Complex PTSD, From Surviving to Thriving, that the origins of complex PTSD can also stem from prolonged emotional neglect, verbal and emotional abuse. Nonetheless, research is still being done to understand complex PTSD. To help you understand complex PTSD, I created a fictional character by the name of Jane. You'll also see the origins and the development of complex PTSD, as well as the aftermath. So, Jane is a 5-year-old girl who was born into a family with generational trauma. Her father was physically abused by his father as a child, and his mother abandoned the family when he was 8. Her mother never knew her father, and she was raised by an alcoholic mother who was critical and emotionally abusive. Jane's mother and father were very unhealthy together. Jane's father was physically abusive towards her, and he would hit her with a belt or any object he can get his hands on, anytime he felt that she didn't do what was right in his eyes. Jane was fearful of her father and walked on eggshells. Jane would always look to her mother to rescue her, but her mom was also emotionally abusive towards her. She would yell at Jane for making her father angry. Jane's father also was abusive to her mother, both verbally and physically. Jane's mother blamed Jane for his rage. Jane's mom tried to please him by being an obedient wife. He would be calm one day and become a volatile storm the remainder of the week. Jane knew that she was on her own and she had to figure out how to survive. Jane's teacher noticed that she was shy and quiet. She didn't make friends easily and she preferred to play on her own. Jane started to self-harm in the 7th grade by cutting herself to manage her anxiety. Jane also made friends with older kids in the neighborhood and she would drink herself to sleep. They ended up ditching her because they thought that she was weird. Eventually the drinking stopped because the older kids were no longer supplying the alcohol for her. The verbal attacks by her mother and physical abuse by her father was happening on a regular basis. Jane became numb to the beatings and verbal abuse. She withdrew further into herself and exhibited signs of depression. She was very anxious and exhibited social anxiety. She didn't tell anyone what was happening. When Jane was 18, she left home. She moved in with her boyfriend and she was physically and verbally abused. Jane blamed herself and tried to please him so he wouldn't get angry. If I was a better housekeeper, he wouldn't get angry. If I was prettier, he wouldn't cheat on me. Jane surrendered to the negative thoughts and perception that was developed in childhood. Her relationship lasted 2 years and then he kicked her out. Jane ended up in a women's shelter at the age of 21. She worked part-time and was an excellent employee. She also did what she was told. Again, she kept to herself and was socially awkward. Jane thought she would be loved and accepted if she pleased the men that she dated. Jane was depressed, anxious, critical of herself, had low self-esteem, angry, confused, sad, and she had passive thoughts of suicide. On the outside, you couldn't really tell, but on the inside, she was suffering. She didn't have a sense of self, and her identity was tied to mistreatment and self-blame. The shelter connected Jane to a therapist, and the work began. The voices of her parents became her inner critic, and she repeated the cycle of abuse by dating narcissistic, abusive men just like her father. She also reenacted her mother's behavior by thinking if she were to be obedient, her partners wouldn't get mad at her and they wouldn't hurt her. Jane was numb to her own emotions and she didn't have much self-esteem or self-worth, and her isolation as a kid created fear of judgment and social anxiety, which prevents her from making friends. Dr. Judith Herman stated in her book, Trauma and Recovery, a secure sense of connection with caring people is the foundation of personality development. When this connection is shattered, the traumatized person loses their sense of self. If you don't know Dr. Herman, she is a professor and psychiatrist at Harvard Medical School, and she's also known for her work in trauma, PTSD, and complex PTSD. Due to the traumatic events experienced in childhood, development becomes impaired and shattered. Your ability to gain a sense of self and identity through autonomy, decision-making, engaging socially, positive connection, self-esteem, and self-love has definitely been compromised because of the prolonged traumatic events. Those traits were never fostered due to the unhealthy environment that you were subjected to. Because of that, you were in constant survival mode. Your sympathetic nervous system was triggered and activated the fight, flight, freeze, and fawn response. If we think back to the example of Jane, she experienced flight, fawn, and freeze. She became avoidant and withdrew from situations, which is flight. She became a people pleaser with her boyfriend and at work, which is fawn. And then she dissociated and became numb to the beatings and verbal abuse by her parents and her partners, which is freeze. We tend to repeat our childhood and adolescent experiences as adults. People also become more susceptible to getting involved in abusive and unhealthy friendships and romantic partnerships. After experiencing trauma, we can become very guarded, numb, or hypervigilant to the world. I've often mentioned to folks that they're so tightly guarded, it's like they're wearing a bulletproof vest, they have barbed wire in front of them, there's like a steel fence, and they're protected by 2 large guard dogs. Nothing bad can get in to attack them. But while they're keeping themselves safe, nothing good could also get in. When we are disconnected, we lack self-awareness, self-compassion, and empathy. We are numb to our emotions and tolerate mediocre behavior, which leaves us vulnerable to abusive behavior. We bully ourselves and criticize ourselves for everything. If I weren't so weak, I wouldn't have depression. If I were in control, I wouldn't have anxiety. If I wasn't so awkward or weird, I would have friends. If I wasn't so helpless and useless, my ex wouldn't have hit me. If I wasn't scattered, my life wouldn't be such a mess. You're so used to people not caring about your needs and your wants that you've become defeated and helpless. As an adult, you worry about judgment, you find it hard to make decisions, and you don't trust anyone. You feel lonely, and you may keep yourself hidden, or you date unhealthy people, reminiscent from the past. You don't know what to do, you don't know your values, you don't know what you need, and you don't have boundaries. I find that so many people beat themselves up for not getting their life together. What's wrong with me? I should have been further along in life. Why am I such a screw up? I make mistake after mistake. What happened to me was years ago. I can't blame anyone but myself for my failure. What didn't happen is an important piece to the puzzle that many folks who have experienced prolonged trauma often forget. Author and trauma expert Dr. Gretchen Schmelzer, in her book Journey Through Trauma, she discussed 3 experiences of repeated trauma. Number 1, the traumatic experience itself, meaning what happened and what do you remember being exposed to. Number 2, what did we do to survive the trauma, our protective factors and the ways of coping and how it has changed our personality. Number 3, what didn't happen. I want to focus on number 3 because an important step to changing the narrative and introduce self-compassion, warmth, empathy, and awareness during treatment. Let's say as a kid, you arrived home to a screaming match between your parents. Perhaps you walked in and saw your parents in a physical altercation. Your parents would also barge into your room, calling you stupid and worthless for not washing the dishes, or you feared being abused on a daily basis at night. During the traumatic events, there was no one helping you with your homework. There was no one that you can be emotionally safe with because you had a bad day at school. There was no safe parent to talk to about the abuse. No one said to you, have a great day. There was no one to shoot the breeze with or watch cartoons with on a Saturday morning. There was no one to praise you for all the good work that you've been doing. There was no one to give you advice about dating. There was no one telling you, good job, and you couldn't relax when you were at home because you didn't know what to expect. No wonder you feel anxious. No wonder you have symptoms of depression. No wonder you feel awkward around your peers. No wonder you lack trust, you lack self-compassion. No wonder you have attachment wounds. No wonder you have low self-esteem, and no wonder you feel worthless. You didn't have a normal developmental growth. Instead, you were being traumatized. This is an important piece to treatment because this is the part we all forget. Now that we're an adult, we automatically assume that we should know everything. We should know how to treat ourselves, we should know how others should treat us. But the question is, who would have taught you all of these things? Who would have shown you the ropes? Now as an adult, we worry about bills, working, keeping a roof over our head, being a good parent, being a good partner, but the foundation was never set. We are functioning on a deck of cards, and at any moment, our world can crumble around us. We constantly feel anxious or numb, and we never feel settled no matter how much we try. Sometimes you're barely holding on. We blame ourselves for not knowing. We don't realize that we're operating and existing in old yet familiar narratives from our past that keep us stuck. Working towards healing isn't an easy process, but it is possible. Everyone's story is unique, and the process can take longer for some than others. You're trying to repair the shattered pieces of your life. It can be hard to connect back to our story because it makes it real. Connect with a therapist who can help you engage in recovery. The 3 stages of recovery, according to Judith Herman, include safety and stabilization, remembrance and mourning, and reconnection and integration. I have 3 book selections that can be helpful with working through complex PTSD. They have strategies and solutions to help you navigate and process. I'm sure you can also find the books on Audible. This is book number 1, which is Trauma and Recovery by Judith Herman. This is another book that I find fascinating, which is Journey Through Trauma. And this is also another book that I really like, and it's called Complex PTSD: From Surviving to Thriving. If you made it to the end of this video, thanks for watching. Check out my video above on narcissistic mothers. Leave a comment below and let me know what your thoughts are, and let me know what videos you would like to see next. Don't forget to like, subscribe, and share, as it really helps my channel grow. Bye for now.